Doctors are seeing COVID impacting so many parts of the body and the mind. Joining us to provide some insight on the issue of mental and heart health is Dr. Heather Swales, Director of Women's Heart Wellness Health at the Hospital of Central Connecticut. Doctor, welcome.
Hi, thank you.
So what is the link between mental health and heart health?
So we know that there are lots of mental health disorders such as anxiety and depression that are really common in our society, as is heart disease. And interestingly, people with anxiety and depression have higher risk for heart disease, and people with certain types of heart disease such as heart failure or following a heart attack are more likely to develop anxiety and depression. There are probably two pathways that explain this association. One is behavioral, because people with anxiety and depression are more likely to have increased rates of unhealthy behaviors. And then there's also a direct impact that anxiety and depression can have on the heart and blood vessels through neurohormonal changes, inflammation, and platelet activation.
Interesting. All right, how can someone tell the difference between a heart attack and a panic attack?
That's a great question. They're pretty common conditions, and they can both be really scary. A panic attack is not life-threatening, but a heart attack can be. So telling the difference between them is really helpful, but not always easy. It's really important to remember, if you think you're having a heart attack, that you call 911. Both of them can be associated with sudden onset of chest pain or chest discomfort, but some differences are that heart attacks are often brought on by exertion and sometimes emotional stress, whereas a panic attack can sometimes come out of the blue. It also could be triggered by emotional stress. One key difference is that panic attacks get better with time, and they typically only last about 20 to 30 minutes, whereas a heart attack tends to get worse with time and often lasts much longer. With a panic attack, people often describe a tingly or a prickly sensation around their lips. It can go into their arms or hands, whereas with a heart attack, people often describe the pain or discomfort radiating into their jaw, their neck, their back, or their arm.
Great description there. So different. All right, what can women do to improve their heart health, especially during these tough times?
So it's really important that people are staying in touch with their doctor. They should eat healthy, exercise regularly, make sure they're getting enough rest, and continue taking their medications as prescribed.
All right, doctor, real quick, tell us about your upcoming webinar.
So I'm doing a webinar tomorrow. It's a free event for the public about mental health in the heart, where I'm going to talk more about the signs and symptoms of depression and anxiety, go into a little bit more detail about what people can do to help keep their heart healthy during the pandemic, and we'll have time at the end for some questions and answers.
All right, so real quick, Tuesday, again, that's tomorrow from 12 to 1. You can join Dr. Heather Swales with her webinar. All right, great information for women. Thank you so much.
Thank you for having me.